Good morning and welcome to Futures Recovery Healthcare. My name is Cindy Goss and I am an outreach professional here at Futures Recovery Healthcare, which is located in Tequesta, Florida. And we are a residential treatment program both for substance abuse disorders and also newly licensed for our mental health program. We are here today to talk about our newly launched Heroes Ascent program that basically was created by first responders for first responders, which is very important as they lived and walked those shoes. And we have our distinguished guests with us today to interview Bruce Chapman, who's one of our new advisory board members that we had put together. And so I want to welcome you, Bruce, for joining us.
Thank you very much, Cindy. It's a sincere pleasure, and I certainly look forward to working with the group and all the amazing work that's being done.
Well, you remember when you were able to visit and tour our facility just a little bit ago, that the program basically is targeting our law enforcement, corrections, fire personnel, EMS, paramedics. We're working with dispatchers and medical personnel, and of course our heroic military veterans to assure a safe environment with the proper treatment, especially treating PTSD for our heroes. And I know you have quite a history in Canada, and I'd like to know if you could share with us a little bit about your background.
Well, thank you very much. Yes, 40 years of policing. We'll be officially retiring from the police service at the end of June of 2021. And moving on to some other ventures and to be able to work on mental health and wellness of first responders. And, you know, I think your comments are most fitting when you talk about the group of individuals that Futures help and how important it is for that first responder sector. And so a bit about myself from the past. There are 40 years of policing with Peel Regional Police, which is just outside of Toronto. It's one of the suburbs, over 3 million people in the GTA area, that including Pearson International Airport. I started as a young police officer, of course, in uniform patrol. Very fortunate in my career to work a number of areas, including criminal investigations, major crime, the drug squad undercover for 5 years, fraud squad, on to major crime, homicide, central robbery, and then finished up in forensic identification. So very blessed in my career. And also spent a considerable amount of time in the police association world, being a chair of a local police association board, Peel Regional Police, the chair for 12 years, and then moved to the provincial board, first as a director, then the chair, and then the first time full-time president of the Police Association of Ontario, where I represented over 28,000 members, both sworn and civilian, throughout the province of Ontario.
Looks like you had a very busy career.
Full career, yes.
Full career. Well, we have done a lot crossing the border from the US to Canada when it comes to the mental health and wellness of our first responders. And working with whatever agency, we have all pretty much, you know, came to the same conclusion that regardless of what side of the border, regardless of what color or the size of your badge, we're both alike. We're both working hard, putting our lives on the line, as well as trauma is trauma. And the PTSD that's encountered doesn't change regardless which side of the border we're on. So I want to talk a little bit about the importance of addressing mental health. And we've already discussed in the past about how mental health kind of gets put on a back burner. And in some agencies, after their initial psych exams to get on the job, they never, ever experience anything psychological or mental health counseling unless something happens or their career is over. So I want to talk a little bit about that stigma about mental health. Are we evolving and are we changing?
Here's some Very interesting point, Cindy, and you're right. I recall the first time I met you, some of the work that you were doing, although in the US, you were working with some of our Canadian counterparts in the Niagara region. And that was one of our first meetings that we came from. And we were just starting and exploring and getting into providing guidance, support, and assistance through, along for mental health of our members. And it was fairly new to us in Canada. I can go back 40 years ago when I started on the job and going to your calls, and basically it was suck it up and move on to the next call. This is what you signed up for. There was no supports in place, and it affects everybody in a different way. Some struggled, some continue to struggle. And then we'll get into, I'm sure, during our conversation about other aspects of PTSD, such as substance abuse and addictions and others that come as a result of the trauma that members face. So very real, very trying. And, we have finally, I praise the police associations, who were some of the first ones, in the police unions were the first one to recognize the importance of mental health and wellness for members, and champion that cause over the last number of years. And I'll tell you about my first position as the president of the police association in 2015 was to nonstop champion presumptive coverage of PTSD for police personnel and our dispatchers and call takers, so that it's presumed that you wouldn't have gotten on the job should you develop post-traumatic stress or an occupational stress injury.
And that's important because a lot of agencies don't cover that, because then it's going to cost them money, because now they're going to take like disability, they're going to take retirement disabilities, which they're going to have to pay for. And if they recognize one or two, that kind of opens up the can. Now everybody is applying for PTSD. So they always kind of keep a wrap on that, because again, it's all about the money rather than the welfare of that officer.
Yeah, and we had those same challenges up here in Canada, as I know you do in the US, and with the greatest of respect to senior management, because I think they're getting on board now. But that was the fear, is that, oh, everyone's going to go off with with PTSD or a mental health injury, the costs are going to skyrocket. But what evidence has proven and data has shown is that the sooner we can get help for our members, the sooner we can get them back on the job. No one signed up to be off with an illness or an injury, whether it be mental or physical or any other injury. They signed up to serve and protect our communities. And the only way they can do that is if they're healthy and they're happy. And that's why it's critical to ensure of the mental health and wellness of all of our members.
Member of service of 10 years in Canada, what would the price tag be on that officer if it had to be replaced?
Well, 10 years, you're looking at $1 million to get an officer fully trained and functioning on their own on the road in a year. We have pretty substantive standards here in Ontario, because provincial policing in Canada is based on provincial or states, similar to you have in the US. So in Ontario, the cost of from hiring an individual who applies to having them fully trained on the road has been estimated at $1 million. So there is the first number that I can throw at you, is $1 million. So we have someone who goes off, we're losing $1 million of investment. And it's not about the money, it's about the individual, but that's where we start.
Exactly. So it would make sense to make a contribution into that officer's wellness, whether it's the pre-education, ongoing education, or that stress inoculation training, but also identifying early on preventative measures if you see signs of, say, suicide or the PTSD or an addiction. It's less costly to treat that through a program than it is to replace that officer and then start all over with a new recruit.
The earlier we invest in the health and wellness of our members, the greater benefit everybody will get out of it, whether it be the taxpayers, the employers, the employees themselves, their peers, their family, and outside of the police service. That's how critical it is to invest in it. So much so, Cindy, that here in Canada, our police associations or our police units, unions have now recognized that mental health and wellness benefits far exceed dollars and cents as far as raises go. We're far more likely to negotiate or bargain better health and wellness benefits for our members. And that's how important it is, and where we have come from where we were a number of years ago. And I think senior management is now getting on board and realizing the value of, the same philosophy of helping our members early.
That's awesome to hear, because when I'm in the police academy and I'm teaching the recruits, those recruits someday are going to become supervisors or future frontline management. And if we can get to them there and get them to understand the resiliency needed, understand their human being behind that badge, and that when they encounter incidences, here's your supports, here's your peer, here's your EAP, here's your union, here's your chaplain, which is in the department, which is critical to identify that not only for the officer, but what about your families? Do your family members get the support that they need?
That is so critical. Is in one of the deputations I did in 2018, the chief coroner in Ontario recognized, well, we all recognized, but there was a large number of police suicides in the province of Ontario of police personnel. And the chief coroner actually did assembled a panel of experts throughout North America, including LA Sheriff's Office, police professionals, and health professionals, got them together to do a review of police suicides in the province of Ontario and police. And I did a deputation to them, and that was one of the pillars I used about family support, recognition that family members, whether it's a spouse or a child or a parent, will recognize when the police officer or the first responder is struggling, sometimes far before coworkers or peers and supervisors in the police department. So that's why it's so critical to ensure that family receives some of the care and teachings and to go forward, because they will recognize it as quick. And the whole motto is to end the stigma. That's where it has to start.
That's exactly where I was going next. It's the stigma. As we know, Dr. John Violante, one of the leading forefathers of critical stress PTS movement in the world, let alone the country, he often, when he speaks, talks about breaking the stigma for asking for help is like bending granite with your bare hands, because it is so difficult and hard. How much of that stigma plays a role in, say, the suicide rate or officers being arrested or losing their jobs?
A lot. Tragically, sadly, a lot. I pray and I hope and I believe that we are slowly moving the needle to understand stigma. We have had some senior police personnel come out and talk about their own struggles with mental health and the contemplation of dying by suicide. And it's real when you hear it from a leader say it. So we're getting there. We have a long way to go. But again, it all starts with the younger recruits and the new members coming in. A lot of times we're not going to be able to change the 20, 30, 40-year person in policing or being a first responder, because that's all they grew up on, and some of them aren't subject to change. I feel so blessed that I was able to, I got it, and 40 years on the job, 30 years on the job, I started to really pick up on mental health and wellness and how important it was and how critical it was. As a mid-level supervisor, it was my duty and my responsibility to make sure my members were okay. So we're getting there. We're not there yet. We have a long way to go. I wish someone could snap their fingers and end stigma. It won't. But the more we talk about it, and the more we're open about it, and the more we share, and the more resources we have, such as Futures, and even some of the calls, we have an organization here in Ontario called Boots on the Ground, run by first responders, volunteers. You can pick up the phone, anonymously and speak to someone who will help you if you're struggling. And it's just critical to moving forward. And nobody wants to lose another life to suicide in our profession.
Correct. And again, I think the issue of trust and confidentiality is key, because unless you can provide that, if they don't have that perception, they can trust you, they're not going to respond. But they got to know that they can trust you and that you care, because they're not worried about how many letters you have next to your name. They just want to know that they can trust you and that you care, which is one of the reasons we put Futures Heroes Ascent program together, because the whole environmental experience, they respond to us by saying, I feel safe here. And safety is critical. And I'm wondering, when you had toured the facility, what your thoughts were, and that it would be appropriate for some of your personnel.
Oh, absolutely, without a doubt. There are a number of mental health and wellness has jumped forward. But when you put a program or a treatment facility together, it has to truly meet the needs of first responders. And right from the time I walked in the front door to the time I left, and in our conversation, Cindy, I wouldn't put my name, or I wouldn't stand behind something I didn't believe in. And when you see the program and the personnel that you have, it's critical, it's clear that there is a true desire to help. Trust, you mentioned trust, and it's critical, and it's clear, the guidelines and what is set to ensure that for the safety and well-being of all the people that attend.
Well, we do appreciate your kind comments, and we are just thrilled and honored and feel a privilege of having you joining us, coming in from a different country as well. And we look forward to our relationship with you. We look forward to your advisement in the future, and as to how can we help you? How can we help our Canadian counterparts? Where I live, I'm 15 minutes from the border, and it's really easy and accessible to get members in crisis from you to us very quickly. So I want to not only thank you for your service, but thank you for your continuation of still helping, but now you're internationally helping other officers and family members, because the bottom line is we are saving lives, and we thank you for that.
Well, thank you, Cindy. And like you said, once our borders open up, there really are no borders when it comes to the health and wellness of our members. It's about getting the help any way and every way we can to get them back healthy and happy and productive. And I see that being the road forward. I'm blessed and honored to work and be associated with you and your group, and I look forward to the future.
Thank you again. I wish you well. You stay safe, and God bless.
Great, thank you, Cindy, and you too to everyone. Take care.